Hi everyone, today I'm here with Melanie, an RDN and CDE, who's here to talk to us about her profession. So thank you, Melanie, for joining us for this interview.
Thank you.
And so before we get into kind of the details of being an RDN and a CDE, could you first tell us what is an RDN and what's a CDE and what do the practices involve?
A registered dietitian is a nutrition professional. It's the person you would go to for a variety of health concerns, whatever you might need, be weight management, diabetes education, if you have a tube feeding, a wide variety of things. So there's a 4-year undergraduate that's required and a national exam after an internship that's required. Sometimes the 4-year undergrad and the internship are combined. That's a didactic, it's a coordinated program. The didactic program is separate, 4 years, then the internship, and then a national exam. Starting in 2024, they will be required to have a master's degree to be a dietitian. So anytime between now and then, you don't need a master's, but after that, the profession will be requiring a master's. A CDE is a certified diabetes educator. It requires that you've been educating people on diabetes self-management for however long. Usually you want at least a year experience, but you are required to have 1,000 hours, 400 of that being in the last year before you take the exam. So you want to get a good amount of experience before you actually take it's a national exam to be certified as a certified diabetes educator.
For becoming a CDE, that's just a certification on top of that, or? Yeah,
so the CDE is extra. Dietitians don't have to get their CDE. Basically shows that you're specializing in something that you care about or that there's a need for. Diabetes is really prevalent in the U.S. and it's growing worldwide, so there's a huge need to provide people the education they need to take care of it on their own.
Okay, and so for a CDE, obviously you're going to be handling diabetic cases. What are the most common cases you see as an RDN?
Well, it kind of depends on where you're gonna be. Outpatient dietitians deal a lot with weight management. I have a lot of bariatric patients, pre-surgery and post-surgery. I also have people come in for tube feedings, end-stage liver disease, chronic kidney disease, and end-stage renal disease. High blood pressure, cardiovascular disease. There's a huge variety of different conditions, and most of them are. Most people have a couple or more different conditions that you've got to look at the data for. You want to look at the weight trends and the meds that they're on, their vitals, and then you go into their history and their lifestyle and how you can help them.
Mm-hmm. What is the scope of practice of an RDN and a CDE versus like other health professionals, say like a nutrition PhD or a physician? And when would they refer to you and when do you refer to them?
A dietitian, we deal with nutrition diagnoses. We don't make medical diagnoses, so medical diagnosis would be out of our scope of practice. Just recently, and I think it was in 2014, dietitians are now able to write orders for diets in an inpatient setting, a hospital setting. But the hospital can also decide that may not be what they want to do, but by law we can. If the hospital decides they don't want their dietitians to write orders, they don't have to. We can't write orders for medications or things like that, but we make a lot of recommendations to providers based off what the patient needs. And as a CDE, we are specializing in diabetes nutrition and also the medication. So the diabetes medications are constantly changing. Insulins, there's new insulins all the time, and some of them work a lot better. And there's GLP-1s and SGLT2s that we look at what the medications the patient's on and some of these new meds that they might be able to try that might work better based off of what the patient's goals are too. So a lot of times patients want to lose weight, and there's a lot of medications that actually can cause weight gain. So as a CDE, I can look at those and make recommendations for medication changes, but they're always recommendations. I can't directly order medication changes. So it's a team effort. It's really the support for the doctors in that cases. Doctors have to know a lot, and it's nice to have these specialized, these subspecialties to help them out.
CDE, you mentioned, is one of the ways you can specialize as an RDN.
Mm-hmm.
Are there other ways you can specialize too, or is it more general usually?
For dietitians, yeah, you can specialize in renal care, and anyone who works for like DaVita or Fresenius specialty, they are specializing, generally speaking, in renal in renal nutrition. And you don't have to get that specialization, but you can go through a program to take an exam and specialize in that. Gerontological, oncology, pediatrics, sports nutrition is a big one. So yeah, you can specialize in any of those, and even like CDE is a certification. You can get CNSC, which is Certified Nutrition Support Specialist. So for a dietitian working in inpatient care with patients who might need TPN or any tube feedings, a lot of dietitians who do that as their full-time job will get the CNSC. It basically shows that they've got the years in and they've got the experience, and they were able to take a major exam to prove that they know what they're talking about.
And why did you choose to become an RDN and a CDE?
Well, I have a lot of family members and family friends who had health problems, and a close family member was able to lose weight and reduce the amount of medications they were on by making changes to their eating habits and their exercise habits. And I was very young when I witnessed that, and I actually went into college pre-med thinking I wanted to be a chiropractor, and got to change courses and decided to do something else, and that other major that I switched to wasn't what I wanted to do, so I kind of had to think, what do I want to do? I like eating, and I know some people who ate really well and improved their health, so maybe I'll look into that. And I think I Googled nutrition professional and found out it was called a dietitian. And I was going to Michigan State University at the time, and realized that school actually has one of the best known dietetics programs in the US. So I went to the counselor, and she had a whole schedule made up for me already, and got into the program and took my first nutrition class, and was really glad that I did, because it makes a lot of sense. It helps yourself, it helps you talk to people about it. Evidence is constantly changing, and that's super interesting. So I love being able to support people and helping them understand that.
What's a typical day in your life like from when you come in to when you leave, and does that change based on the day?
Right now, it's a little bit different than it was. For an outpatient dietitian, you come in, you look at your census to see who's scheduled to come. I see those patients one-on-one. I also have group classes, so I teach a gestational diabetes nutrition class with another CDE who works for Adventist. She's a nurse, so she does the insulin portion. She helps, go over the logbooks with them, and I can do that as well. We kind of teamwork, and I do the nutrition portion for that. I help out with different group classes around this area. Last Friday I had a pulmonary education group that I did. I go to support groups, so more the outpatient world is a bit different than the inpatient world. So in my internship I did more inpatient, so that's you come in and you get your load of patients to see. You go to different units and different floors. You're in the hospital, whereas outpatient is a little bit more laid back and flexible. You go around to different places.
How are the hours in the lifestyle like from inpatient versus outpatient?
They're not too far off, too different. The main difference I would say is that inpatient, they will often rotate weekends. So they need to have coverage, 7 days a week. So the dietitians will be there on the weekends too, but usually just a couple of them as opposed to the whole crew. Their hours are generally from, between 7 to 3 and 8 to 4. If they have an hour lunch a little bit later. And outpatient, really, there's no weekends unless they are involved in, there's volunteer opportunities that you can get involved with on the weekends. But it's generally Monday through Friday, 8 to 5, and weekends off.
What's the most challenging aspect of being an RDN and a CDE?
Well, it's a lot of psychology. So you're dealing with people and their behaviors. At least for outpatient, you're trying to motivate people to find it within themselves to make changes, and that's not always easy. You think about trying to make changes for yourself and change your own habits, that's not always easy. So trying to talk to people and help them find out what motivates them to get them to make changes they already know they need to make a lot of times. It's just finding what works for them, small steps, and that can be really challenging.
What's the most rewarding aspect of being an RDN?
Seeing those challenges broken down. They can break down the barriers and actually lose weight and make the changes that are necessary to do that, whether it just be a simple thing like cutting out sodas, right? Something as small as that can help someone reduce the amount of calories they need to just lose a pound a week.
Are there any misconceptions about being an RDN?
I think we have a bad reputation of being the food police. That people don't necessarily want to come to us and talk to us about their food, but that's not what it is at all. It really is meeting the person where they're at and what changes are they willing to make. It has to be a challenge to them, but it's by no means telling them what to do and what to eat and what not to eat. Nobody wants to be told what to eat and what not to eat, but we are the support as far as letting them know what the evidence says, and they can make the decisions on their own.
Are there certain personality types that are best suited for being an RDN, would you say?
Yeah, most RDNs are what you might call type A. Very ready to be prepared and they're very driven. But I think any personality type can mold into the career because there's such a variety of areas that you can get involved with being a dietitian. You can be a more of a laid-back personality when you work in the community, but I think it's always good to be organized and flexible too. You have to be adaptable, especially for outpatient or community. You never really know exactly where your day is going to go. Things can change, and your week changes too with different classes and people asking you to do different things to help out their discipline. But inpatient can be pretty intense. They can see 15 plus patients a day, and that's more of a quantity trying to get through the consults, so you have to be on top of your game.
And so you talked a little bit before about just like the general progression to becoming an RDN and a CDE. Could you maybe expand on that a little bit and give other tips for students interested in becoming an RDN for how to get into maybe like a competitive program?
Okay. So really take advantage of the professors. I mean that in a good way. When you're going to, if you're in an undergrad, if you're in any college really, so you're not sure you want to be an RDN or you want to go into the dietetics program, really get involved with the university, get involved with the research at your university. Even before you maybe get into your dietetics program, it's good to get involved with groups at the university. Like for me, once I got into the program, I met up with the professors and I helped be a student aide or a teaching aide. I got involved with the research projects there. So having a variety of things on your resume looks really good. If you're a 4.0 student and you don't have any of these extra things like having a job maybe at a restaurant or getting some volunteer hours at the local hospital, or if you're not involved with research project or helping out with a professor, maybe grading papers, if you don't have a lot of that, it's not looked at as positively. So it's a good idea to just even a few things here and there. It doesn't have to be 8 hours a week. It could just be a 1 hour a week volunteering somewhere, or paid experiences looked on more heavily. So I've done some grading, I guess, of dietetic students applying to the DICAS system. So the DICAS system is what you use to get into an internship, and it's they have a grading system that looks at the resume and the whole application, and paid experience for food service or for clinical, even working in a doctor's office, something like that, is weighted very heavily. But just a variety of things. Again, just being a 4.0 student isn't good enough. If you're a 3.5 GPA with a bunch of experience and really good references, so network and get to know the people you work with. Don't be a robot, right? Have a personality and show up on time and do a little extra and be a fun person, and it'll show in your resume, and that's looked on pretty heavily.
Mm-hmm. What was the progression again to becoming an RDN? It's 4 years bachelor's, and then is it 2 years of clinical? Or?
It varies. So it's 4 years undergrad. Sometimes that's a coordinated program with the internship. There aren't very many of those programs, so there's a few. Most of them are didactic, which is the 4 years. Then you do the internship separately. Now that internship could be, like I said, we got 5 more years where there's master's isn't required. Some of them don't require a master's. Some of them have a master's. You get master's credits with it, and you come out with a master's degree. So the times can vary between, I think the shortest one's like 9 months, and the longest, can be 15 to 20 months depending on, what you're going for. Mine was a 9.5, 10-month program, and it wasn't a master's program, and it was a medical nutrition therapy concentration. And they all have different concentrations based on what you think you want So there's food service concentration, there's more community based, so it might be like, oh, you spend more time in a WIC, for example. So you do the undergrad, the internship, and then you take the national exam, the RD exam.
How well are RDNs and CDs generally compensated, and do you feel like it's fairly compensated?
Well, California is a good place to work for a dietitian and for really any profession. But, I'm from Michigan, and I know I haven't been paying attention to too much to how the salaries have changed there. But it's almost, the highest is probably double. Yeah, it can be more than double of what you get paid in another state, especially the Midwest. In California, even just the last 5 years since I started working here, the pay has gone up significantly. I worked for the state for 5.5 years, and it went up, I think I calculated 65% increase from when I started as a contract there. So now they're paid pretty well. They're one of the higher paid state employees are. And outpatient, generally speaking, in California, dietitians get paid pretty well. And you can do a lot, like I said, in general, anywhere. So if you have a full-time job, if you do something on the side, that adds to it. You can have your own NPI and be your own dietitian, have your own business, your own name. And network enough, you'll have enough patients to supplement that.
Mm-hmm. Okay, and it seems like the job outlook is very good for a dietitian. Are there opportunities to advance with maybe managerial positions, or different levels within dietetics, or how does that work?
Yeah, you can be a manager. You can work for a supermarket. You can work for the state or the city or the county. For public health, you can be your own dietitian. You can work for the schools. Mm-hmm. It's really, the opportunities are endless. Okay. And even you can move from being a dietitian to being an admin. You can be a hospital administrator. There were the administrators in the state. Some of them were dietitians, so you can do a lot.
Okay, and for dietitians looking to increase their income, how would you recommend they do so? Is it more geography, moving to California or somewhere, and maybe working other jobs like you mentioned before, or other ways you could maybe increase your compensation?
Definitely moving to California helps. But getting specializations, having extra credentials after your name, having a master's can increase your pay, but it doesn't always. So having a CDE bumps your pay up quite a bit, depending on where you go. I know UC Davis, their range for an RDN CDE is $88,000 to $110,000, which is pretty good for a dietitian. Dietitians who work for a supermarket can easily be over $100,000 depending on where they are. But unfortunately, your inpatient dietitians, the ones that are clinical and seeing 15 plus patients a day in a high intensity atmosphere, are actually the lowest paid dietitians. Long-term care is also a really good high paying field. A lot of people start off in clinical. They start off in a hospital, and that's a great place to start and even continue your career, because again, you can move up with management. You could be a nutrition director at a hospital and make more. And just even spending more time in your same position, you will get raises. But expanding your scope, I guess, and getting certifications like a CDE can be really helpful in increasing your, having a boost your resume and then increasing your pay.
And you mentioned previously that there's a lot of advances coming out in medicine and nutrition research. How do you stay on top of all those advances? Are there conferences you go to, or magazines or journals you read, or how do you stay on top of all that?
Yeah, conferences. You have to have, every 5 years you have to get 75 continuing education credits, and it's easy enough to do more than that. You go to a conference and you'll get 35 hours easy, but having an email subscription really helps. I have an email subscription. It's called Smart Brief newsletter. There's a leadership specialty with that, and then also for diabetes and nutrition, I get all of those. So they send you articles from Mayo Clinic to physicians newsletter, and just on the current research that's out there. So reading, staying on top of that, and also analyzing it to make sure that the study is worthwhile, because there's a lot of small studies that are done that maybe are not as you should weigh as heavily. Wait for the meta-analysis to come out and make sure it's not super biased by whoever's funding it maybe. And then also patients come in and say things, and you're like, oh, I will get back to you on that, and do your research to stay on top of what they're telling you, because a lot of times they'll teach you.
Mm-hmm. Okay, and a common trend with health professionals that they often have to deal with burnout. How do you prevent burnout?
Take a moment to yourself every day to take a deep breath multiple times a day. Deep breathing is great. And just making sure you have a space to go home to that is yours and that you can relax and take time to yourself. I also I'm more of a weekend warrior, so I make sure I've got things planned on the weekend. Not every weekend, but something to look forward to. I've always got some kind of a vacation planned that helps with burnout. At work, taking time for yourself. Get a cup of coffee, right? Go for a walk and say hi to people around the office. Don't stay in your own little space. Go for walks on a 15-minute break. We're in a cute little neighborhood right here, and I always go for 15-minute walks, on my break.
What do you do to establish a work-life balance, or what tips would you give us to do so?
I would say force yourself to make plan vacations, hanging out with friends. You have to work hard and then go home and have time for yourself and your friends. So I don't want to do overtime. Don't do too much overtime, and really just relax when you get home and you get the chance.
Is there anything that you would have changed about your career? Any regrets that you had, or any things that you would have done differently?
Honestly, no. It's going well so far. I really like the career. I really like dietetics. I love the variety. You never feel like, oh my gosh, what am I gonna do? Like I said, there's so many things that you can get involved with. If I'm tired of working here in the next 5 years, I can go do something else. There's always something you can use your dietetics degree and your RD and your CDE, and it builds your foundation for pretty much whatever you want to do in the healthcare industry. So, and later on in life, I want to be a lactation consultant. That's something I'm considering, and if you put your mind to it, you can do it. And having a dietetics background is really helpful to just staying in the health field and helping people, because the evidence is always changing, so you're the support for people, and I like that.
In the several years since you started practicing, how has being an RDN changed at all, and what big changes or advances do you see happening in the next couple decades?
Well, I guess one of the major ones really is the fact that we can order diets and in the inpatient world if the hospital allows it, because that wasn't something when I graduated legally we weren't able to, and I don't need to as an outpatient. It's more just behavior change, and where the field is going, really it's already going there as far as the technology and the apps and telemedicine. The consulting dietitians are able to consult with people over the phones, right, as opposed to in person. I think in person's always good, usually better, but just technologically wise, it's advancing in that field. So it's hard to say exactly where it will go, but research is again always changing. So who knows?
One thing I wanted to actually ask you about was, as health professionals, we're always trying to convince patients to enact positive behavioral changes, and as a dietitian, that's the main focus of kind of your practice. What tips would you give future dietitians or even other health professionals to help convince patients to make those changes?
So become very familiar with the techniques of motivational interviewing. It's basically meeting them where they're at, listening. You really have to listen. We know so much. We want to tell people, oh, you should try this and try that, and make this change. But people, as soon as people are told what to do, they kind of turn off and they're like, you're nodding. And so listen and actually watch for cues where people might not be listening, right? And try to assess the situation and see, what did you hear? What did you gain from what we just talked about? And always open-ended questions are key. And it might just be one thing that comes out of that visit, and that's really the best way to look at it. Is you can talk about a lot, but in the end, what's one thing you think you can do differently? It has to be a challenge for you, because it can't be something you're already doing, but it can't be unrealistic. I'm going to go run a marathon today. Well, Probably not going to happen. So if it's just walking around the block, does that sound like something you want to do? Like even if they say, yeah, I'll make that change, asking them, how ready are you to make that change? How real, is it likely that you're going to actually do that, and why or why not? Finding people's barriers, like with diabetes and medications, and you realize their A1C is, or you see their A1C is 10, but they're telling you they're taking all their medications. Well, you have to dive into that because maybe they're not actually taking all their medications, or maybe they're not taking it correctly. Maybe they're just putting the insulin pen in and pulling it out right away and not holding it there, or maybe they're putting it in the same spot over and over and over again and it's not going into their blood. Maybe they left their Atlantis out on the counter and it's been out of room, in room temperature for too long. It might be an old medication. What are the reasons their A1C could be high? It might not be as simple as they're not taking their medication or they're eating too many carbs. It could be something much more complex that they're not even realizing. So you have to kind of dive into that, be a bit of an investigator.
Okay, and last question, what tips would you give future RDNs to become good RDNs, and maybe even what tips would you give general health professionals to be good health professionals?
Keep an open mind, stay on top of the evidence, stay driven, stay curious, right? Always, the moment you realize that you're not curious and maybe all you're doing this for is maybe the money or the location, that only lasts for so long, the money, and you need to stay curious, I guess, and be flexible, because a lot of people, I know a lot of dietitians who are very like, I'm going to do this, and I'm going to do this, and this is going to happen, and I'm going to have, a family at this age, and yada yada, but you never know what life is going to throw at you. So keep an open mind to that, and different opportunities, and network. So networking is going to, throw you off your path. You're going to meet someone who's going to change your mind, and maybe you'll go down a different path, and that's okay.
Okay, well, great advice. Thank you so much, Melanie, for being part of this interview. Thank you guys so much for watching. If you have any questions about being a dietitian, feel free to write them down below in the comment section, and I'll ask Melanie and get back to you guys. Thank you guys again so much for watching, and have a great rest of your day. Take care.
Thank you.